everyone, and welcome back to my YouTube channel. Today, we are delving into a topic that demands our attention and compassion. So, yes, I'm talking about progressive supranuclear palsy, that is PSP. So, this neurodegenerative condition can pose significant challenges, and many individuals and their families are seeking holistic approach to manage its symptoms. So, join me as we explore the potential role of homeopathy in providing support and relief for those dealing with progressive supranuclear palsy. So, if you or someone you know is affected by this condition, then this video is definitely for you. So, watch this video till end for more knowledge and stay connected with us for more informative videos like this. So, let's understand what exactly is the meaning of progressive supranuclear palsy. So, PSP is an uncommon brain disorder that causes severe problems and serious problems with walking, balance, and eye movements, and later with swallowing. The disorder results from deterioration of the cells in the areas of your brain that controls body movement, coordination, thinking, and other important functions. So, progressive supranuclear palsy is also called Steely Richardson syndrome. Progressive supranuclear palsy worsens over time and can lead to life threatening complications such as pneumonia and swallowing problems. So, this is the exact meaning of progressive supranuclear palsy. I hope the meaning is clear to you guys. Now, next, we'll talk about the symptoms of PSP. So, the characteristic signs and symptoms of progressive supranuclear palsy include a loss of balance while walking. There is a tendency to fall backward, occurs very early in the disease. Secondly, an inability to aim your eyes properly. So, you may not be able to look downward or experience blurring at double vision. Its difficulty with focusing the eyes can make some people spill food or appear disinterested in conversations because of poor eye contact. And additional symptoms and signs of progressive supranuclear palsy can mimic those of Parkinson's disease and dementia, and they generally get worse over time, and they may include stiffness, especially in the neck, and awkward movements, falling, especially falling down backward, slow or the slurred speech, problems with swallowing, which may cause gagging and choking, sensitivity to bright light, that is photophobia, sleep disturbances, loss of interest in pleasurable activities, impulsive behavior, laughing or crying for no reasons, difficulty with reasoning, problem solving, and decision making, depression and anxiety, a surprised or frightened facial expression resulting from rigid facial muscles and dizziness. Now next we'll talk about the potential causes of supranuclear palsy. Deteriorating brain cells of people with progressive supranuclear palsy have excess amount of protein called tau. Clumps of tau are also found in other neurodegenerative disorders such as Alzheimer's disease. So, this can be a potential cause of PSP. Now, next, we'll talk about the risk factors and complications. So, the only proven risk factor for progressive supranuclear palsy is age. The condition typically affects people in their late 60s and 70s, and it is virtually known in people under the age of 40. Now, complications. So, complications of PSP result primarily from slow to difficult muscle movements, and these complications may include falling, which could lead to head injuries, fractures, and other injuries, difficulty focus on eyes, which can also lead to injuries, difficulty sleeping, difficulty looking at bright light, problem with swallowing, and pneumonia. And impulsive behavior, for example, standing up without waiting for assistance, which can lead to falls. So these are the complications of PSP. Now, next, we'll talk about the diagnosis. So, what are the investigations that one can perform in order to diagnose progressive supranuclear palsy? So, progressive supranuclear palsy can be difficult to diagnose because signs and symptoms are similar to those of Parkinson's disease. So, your doctor may suspect that you have progressive supranuclear palsy rather than Parkinson's disease if you don't have tremors, are having a lot of unexplained falls, or have little or no response to Parkinson's medications, having difficulty moving your eyes, particularly downward. And your doctor may also recommend an MRI to determine If you have shrinkage in specific region of the brain which is associated with progressive supranuclear palsy. An MRI can also help to exclude disorders that may mimic progressive supranuclear palsy such as stroke. Another test is PET, that is positron emission tomography scan, which also may be recommended to check for early signs of changes in the brain, and they may not appear on MRI. Okay, so these are the various investigations that you can perform if you have any doubt that you are suffering from supranuclear progressive palsy. Now, next we'll talk about the treatment. So, what is the ultimate treatment for progressive supranuclear palsy? So, yes, here we are talking about the homeopathic treatment for progressive supranuclear palsy. So, homeopathy plays a very supportive role in managing the symptoms of progressive supranuclear palsy, and these medications can be taken along with the conventional treatment to give symptomatic relief to the patient and improve the quality of the life. Homeopathic medicines are indicative to manage gait issues, vision problems, speech, swallowing difficulties, and attending memory issues, sleep problems, behavior problem, depression, and anxiety. Homeopathic medicines are selected individually for every case of progressive supranuclear palsy as per the characteristic symptoms. Now, first and the foremost medicine that you can see here on the screen for progressive supranuclear palsy is Illumina. So, Illumina is well indicated to manage unsteady gait, loss of balance while walking in progressive supranuclear palsy, staggering and tottering while walking is present where Illumina is used. There is a need to sit frequently while walking, thighs and legs feel tensed, stiff like cramps with gait problems. Now, second medicine we have is Agaricus. So, agaricus is a very prominent homeopathic medicine for managing the loss of balance while walking in case of PSP. In such cases, gait is unsteady, person feel and totters while walking. There is a tendency to fall forward. Legs may feel heavy and weak while walking. Third medicine is causticum. So, causticum is the next medicine to manage complaints of loss of balance while walking in person having progressive supranuclear palsy. It is most indicated cases of in the cases where a person have unsteady gait with a tendency to fall backward. The next medicine is phosphorus. So, phosphorus is a very significant homeopathic medicine for supportive health to manage visual complaints in progressive supranuclear palsy. Blurred and double vision indicates its use. It's also useful when sensitivity to light, that is, photophobia, is an attendant complaint. The next medicine is Britacarb. So, Britacarb is a prominent medicine for managing mental dullness, forgetfulness, and progressive supranuclear palsy. Person needing this medicine forget familiar words. They're also very forgetful while conversing with. They forget what they have said in a conversation. They have slowness of thoughts, reasoning, and understanding ability is also diminished in them. Next medicine is anacardium. So, anacardium is a very excellent homeopathic medicine which offers help to manage memory problems and forgetfulness in cases of progressive supranuclear palsy. Person needing anacardium suffers from marked forgetfulness. They don't remember anything. Their mind gets extremely weak and dull. They forget the name of close persons and unable to recognize familiar faces. Sadness and high irritability may appear in them. Next medicine we have is belladonna. So, belladonna is a very good homeopathic medicine to help to manage swallowing difficulties in cases of progressive supranuclear palsy. So, person needing belladonna have difficulties to swallow food. They have to drink liquid frequently while eating solid food to move it down. And swallowing is also painful. There is a fear of choking with food while eating, and throat feel very dry. Now, the next medicine for progressive supranuclear palsy is lacasis. So, laches is indicated to manage slow, difficult speech in case of PSP. In such cases, it may be difficult to pronounce words. The tongue feel heavy and move with difficulty. Stammering may also be present. Next medicine is Coffea cruda. So, Coffea cruda is very beneficial for managing sleep disturbances in PSP. There is a difficulty falling asleep where coffea is indicated. The person remain wide awakened at night, though feeling drowsy. Tossing and turning from side to side in a bed is there. If sleep appears, then there is a difficulty maintaining sleep. So, coffea cruda is also indicated for restless sleep with frequent walking, baking. Now, next medicine for PSP is ignitia. So, Ignitia is a very wonderful homeopathic medicine which is mainly indicated for behavior changes like irritability, mood swings, and depression. Let's talk about it. So, person needing Ignitia have marked irritability and mood swings. They become sad with beeping one moment and suddenly followed by happiness and laughing. Fatigue, both on the mental as well as physical plane, is well marked. Ignitia is also indicated for managing depression in person having progressive supranuclear palsy. They remain sad with frequent weeping spells. They are joyless. They prefer to be alone and isolated. There is an aversion to talking. They don't want to do any work, either mental or physical. They become absent minded. Their memory become weak with difficulty in thinking and forgetfulness. They become mentally dull and they also start losing interest in pleasurable activities. Now, our last homeopathic medicine for progressive supranuclear palsy is aconite. So, aconite is a very excellent homeopathic medicine for anxiety issues, and it is highly suitable for treating anxiety issues in person having progressive supranuclear palsy. Such persons have high anxiety attended with restlessness. They have intense palpitations, cold sweat with trembling during anxiety phase. They fear to go out where there is a crowd and have a fear of death. So these are some medicines which has been used for the treatment of progressive supranuclear palsy. If you find this video informative and helpful and valuable, please give it a thumbs up and subscribe to our YouTube channel and hit the notification bell for more insight into the holistic world and the world of homeopathy and natural healing. So thank you so much for joining me on this exploration of managing progressive supranuclear palsy with homeopathy. So, see you guys in the next video. Till then, stay safe and stay healthy. And if you are suffering from PSP or any other health issues, then you can contact us for online appointments. On the screen, you can see how to contact us. So, that's it for now, and thanks for watching this video.